nationally, there's a major shortage in addiction medicine specialists, and Idaho is no exception. Most people are aware of the epidemic of drug overdoses and the epidemic of addiction in this country, and we desperately need physicians who have specialty training in addiction medicine. And really one of the main ways you do that is having fellowships. Here we'll mainly target family medicine residency graduates and internal medicine residency graduates, but it really could be a graduate from any specialty. 1/2 day a week will consist of didactics, and we are going to cover well over 100 hours of didactics. And again, we're pulling resources. We've got a lot of good folks around Boise, and we'll draw people nationally too. We'll tap into some lectures that are given nationally, and try to give our fellows the richest didactic experience that we can. They also will be doing a 1/2 day of MAT clinic here at FMRI, which will be Suboxone, Vivitrol. They'll also have a 1/2 day of clinic in their own areas. If they're a family physician coming here, they'll be doing general family medicine a 1/2 day a week, so they can maintain those skills during the year. Some of the other experiences they'll get, they will be rotating through an opiate treatment clinic, and there are actually 4 in this area where they'll become very familiar with using methadone, and they'll be supervised by board-certified addiction medicine docs at those facilities. Other inpatient experiences they'll get include time at the Boise VA, where they have a very robust detox and rehab center. There's also a pediatric and adolescent psych unit where a number of the patients have substance abuse issues. They'll rotate through there. Some of the other experiences they'll be working with local pain specialists, because that's obviously a very important part of the addiction medicine fellowship. They will be working at a high-risk pregnancy clinic, where they will become very skilled in treating substance abuse in pregnancy. So our fellow will also spend time with behavioral health professionals. They'll become very familiar with how to use SBIRT. They'll get training in motivational interviewing. They'll get training in different counseling techniques. And we want them to come out of here with very developed skills in behavioral health related to addiction medicine. Obviously, we'd like our fellow to be a good team player. We'd like them to be attracted to an academic environment, to enjoy teaching, because they will have a very active teaching role here. We have a lot of residents here. This is a big program. So, from day one, they'll be interacting with the residents. We'll be having them give some lectures throughout the year. During the course of the year, the residents will come to them with a lot of questions, and they will be the recognized expert. Substance abuse occurs everywhere. It occurs in urban areas, it occurs in rural areas. The challenge in rural areas is that they don't have the resources that we have in urban areas. For example, the opiate treatment clinics that exist in Idaho, they're all in the Boise area, the Boise-Napa area. They're not out in the rural areas. So someone in Cottonwood or some of these smaller towns, they don't have easy access to methadone programs. They also don't have the same EMS systems. So if you overdose in rural areas, you're more likely to die, actually, than if you're in an urban area. So there's quite a need to send someone that can provide general family medicine or general internal medicine to a community, but also provide regional expertise in addiction medicine. We've designed this fellowship with that model in mind, to be able to send these docs out to these communities, provide that regional expertise, and at this point I'm fairly confident that we're going to accomplish that.